Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Dave Gustavson. Thank you so much for being here today, Doctor.
You're welcome, Colette.
We are so glad to have you. Today we're talking about Covenant's Wound Healing Center. Tell us about that and the common things that you treat, Doctor.
Yes, it's a wound healing center that's dedicated to treating chronic non-healing wounds. These wounds are usually from pressure ulcers and decubitus ulcers. We also see diabetic foot ulcers. We see venous insufficiency ulcers, arterial insufficiency ulcers, ulcers associated with lymphedema or chronically swollen limbs. We also see ulcers that are related to immune problems and sometimes ulcers from radiation therapy.
Now, Doctor, how can someone tell if a wound's just going to heal on its own or if they should be seen by a specialist?
Usually wounds heal with a natural progression for no more than 30 days. If it's older than 30 days, I would advise you to see your physician. We do accept referrals. We also accept some patients self-refer if they have certain insurances, but that's rare. But especially if you're diabetic and you have a foot ulcer, those need to be seen right away. I wouldn't wait the 30 days.
Okay, that makes sense. That's great advice. Now, what is hyperbaric oxygen therapy?
Hyperbaric oxygen therapy is another therapy that we can offer to patients with non-healing wounds. Unfortunately, we can't treat all non-healing wounds with it. There are only certain wounds that qualify for treatment under CMS guidelines. That's the Medicare and Medicaid insurance guidelines. And those are wounds that are associated with diabetic foot ulcers that haven't healed for 30 days, that have a chronic bone infection. We also treat chronic bone infections with hyperbaric therapy and radionecrosis and a variety of other illnesses and diseases like carbon monoxide exposure and also trauma and crush injuries.
And that's all with hyperbaric oxygen therapy. That is very interesting. Thank you.
Yes.
So tell us, why are you and the rest of the team so passionate about what you do, Doctor?
Well, these wounds are really common, and a lot of patients get used to having the wounds, and they don't think a whole lot of them. And you can live with chronic wounds. Unfortunately, if they get infected, that could lead to a blood infection, and that could be lethal.
Wow. Is there anything else you'd like to tell us about the wound care there?
Yes, the hyperbaric oxygen does amazing things. It is able to treat the wounds by increasing the oxygen delivery to the patient's wounds, but also increasing stem cell growth, increasing capillary growth, and also helping to deliver antibiotics to infected tissue. So it's one thing that is a really strong tool for wounds that don't heal and for sometimes near fatal illnesses and injuries.
And that's available to us right here in mid-Michigan. Thank you, Doctor, for joining us today.
You're welcome, Colette.
And if you'd like any more information about today's topic, you can just head on over to the Hot Links page. That's on WNEM.com.